We hypothesized that there would be a positive association between prenatal stress exposure and psychiatric morbidity among the children. And when we look at the literature, we see that these associations tend to be significant the earlier the outcome measure is assessed. So when mental health is assessed perhaps during infancy or early childhood, there's less and less evidence about potential long-term effects of mental health effects of prenatal stress exposure across the life course. So as we look at studies where children or even adolescents during the later periods of their development or even early adulthood are assessed, we see fewer studies being conducted and the evidence is quite mixed. So it could be that potentially these effects get washed out over the course of the life course. In our paper, we note that especially in low and middle income settings, there aren't many analyses that look at these associations further and further across the life course. So it could be the case that these effects just may have been washed out due to the fact that we assessed mental health later in the life course. Of course, there could be the possibility that these associations just are not significant and there are not mental health effects as a result of early life stress exposure during pregnancy. But of course, as our paper shows, there may be other mechanisms that could be affected by prenatal stress exposure that make their way to affect mental health in the next generation, which of course is what we find.